This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
So my medical minute is going to be on something called cardiac asthma. Have you guys ever heard of this? When you guys think of the exam finding of wheezing on a patient, what is the thing that you think that they probably have? Yeah, right. Asthma is really common. There's another diagnosis that is pretty common also that we see this. COPD, exactly, right? It's bronchospasm, that kind of thing. So if you think about it, when you have someone that's wheezing, what's happening is that there is narrow bronchioles, narrow airways, and then that airflow is turbulent and you get this wheezing sound, okay? When you classically listen to lung sounds and you hear crackles, right, or rales, we think of heart failure, pulmonary edema, among other diagnoses, but that's like a common one, right? Another thing you probably have an association in your head with heart failure is edema. It's like they just like look fairly edematous. In somewhere around like 35%-ish of patients that have heart failure, they get bronchial edema. The air doesn't know any different, right? It's just if the airway gets tight from them getting thickened, they'll still be wheezing. So that is the term cardiac asthma. And I just say this because a lot of the times patients come in and they have both diagnoses. They have COPD and they have heart failure. And we'll listen to them, or EMS will listen to them and say they're wheezing. And so it's like a presumed COPD exacerbation, and they start treating them with Solumedrol and Duonebs. That is just a very different diagnosis than heart failure, right? It's like this patient needs Lasix, and they might need BiPAP, and they need to get on goal-directed medical therapy and things like that. And so it's just really important to know that you shouldn't really hang your hat on the exam finding of wheezing when you have a patient that might have both those diagnoses, because wheezing can be a sign of heart failure. That's really it. So when you have that, it doesn't answer the question of COPD or not. It's just always ask yourself, could this be heart failure? So that's really just the take-home point. So the term before is cardiac asthma. This is the person that we have to think, okay, could it be heart failure? To answer that, there's some clinical questions you can ask. Like I often ask questions about orthopnea, paroxysmal nocturnal dyspnea. So when you sleep at night, can you sleep laying up or can you lie flat? Do you wake up in the middle of the night gasping for air? If they have that, those are like heart failure questions. And then just doing a bedside ultrasound will really help answer that, right? You just put an eye on their chest and take a look. And then if they do have heart failure, then I diurese them, right from the get-go. And it really, again, it shows the power of diagnostic momentum. Does anyone have any questions about that? All right.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.